Lymphoma is a cancer of lymphocytes. Those are normal white blood cells that are found in lymph nodes, bone marrow, and other cells that are present in other parts of the body, the spleen, as well as in the bloodstream. And they're part of the immunity, so to speak, of a person. They contribute to, they eat up cells that are cancer cells. They'll eat up abnormal cells that are in the body, but mostly they produce antibodies that also keep us from getting infections. And when we get an infection or a cold, our lymphocytes spring into action and make antibodies that will help get rid of that infection. It is the 5th most common cancer, but it's the 2nd fastest growing cancer in this country, just after melanoma, which is the fastest growing malignancy in this country. There are only a handful, really, of major lymphoma centers where the doctors treat only lymphoma. Together, if you look at all the doctors who are involved in our clinic, including the radiation therapists, the pathologists, which represent an important part of the management of lymphoma, as well as all the physicians who treat the various illnesses that are lymphoma, there's a lot of expertise. I think MD Anderson would be one of the places to go for sure in this country. I'm a strong advocate of nutrition as well as health maintenance and physical activity, not only after treatment but also during treatment. I think it's very, very important to maintain a proper nutrition as well as proper physical activity. I think that avoiding the words, I can't do this, I'm not able to do that, I think we should avoid that kind of concept and instead feel empowered by the management of this disease and knowing that we can move forward once we have the diagnosis as opposed to being set back. Bill and his family are obviously excellent examples of this kind of concept. Many patients are able to carry on, perhaps not full activity, but are able to still carry on a lot of activity that's normal. I firmly believe, and I think most of us do who treat lymphoma at least, that one should maintain as normal activity as possible in order to be sure that you don't feel as if you're backed into a corner. There are more cans than there are can't. Education about what you've got and how you should deal with it is really important because it does give you power. I think knowledge is power, and I think that any way that we can contribute to not only physician education as well as other paramedical personnel, but also the patient and caregivers. Those are very, very important pieces. And I will do anything that I can to spread the word about what lymphoma is and how we should approach it in the United States and how we need to move forward.